So in order to reach the microbe, we need to give the antimicrobial drugs to the host of the microbe. So we really have to consider the effect that the drugs have on the host. Drugs can have toxicity to the organs, including the liver, heart, brain, skin, and teeth. It can cause allergies. Penicillin and sulfonamides have the most allergies, although that doesn't exclude many others. We also see disruption of the normal flora. We can see destruction of beneficial resident microbiota, not only in the intestines, but in other regions of the body too. Often an antibiotic is targeted at a specific microbe that's involved in a balancing relationship with another microbe that's not affected by the antibiotic. For example, most women are familiar with this idea. If you ever have a urinary tract infection and then take antibiotics to cure it, which you kind of have to with a urinary tract infection, then you often end up with a yeast infection. Why is this? Well, usually for a urinary tract infection, cephalosporin is used. Well, this kills the Escherichia coli bacteria that cause the urinary tract infection, but it also destroys the lactobacilli bacteria in the vagina. The lactobacilli bacteria are there to keep the environment acidic. If the environment is no longer acidic, then that favors overgrowth of the Candida albicans yeast. Now, Candida albicans is a natural resident, a normal resident of the vaginal environment. However, it prefers a less acidic environment. So if the lactobacilli bacteria are no longer there, then the environment becomes more basic and it favors the growth of Candida. These are called superinfections. That is, when an antibiotic is used and it kills bacteria in an environment that allows overgrowth of another species because now everything's out of balance. On the right, you can see a table that shows the major adverse toxic reactions to common drug groupings. It's also a nice summary table of all the drugs that we've covered. Now let's look into some of the details about how we might select a particular antimicrobial for the treatment of any given infection. Really, three things need to be considered. First of all, the nature of the microorganisms causing the infection. Second, the degree of the microorganism's susceptibility to these various drugs. And then third, the medical condition of the patient. We need to take a careful medical history. When we're considering the nature of the microorganisms, we can direct exams of body fluids, sputum, and stool. Sometimes this gives us a clear indication of what the infection is caused by. However, sometimes it might be undefinable. Then the doctors resort to epidemiological statistics, as in what's most common in that area at this point in time that presents in this sort of manner. It's particularly important to look at the susceptibility of the microbe in question, especially when it's in a group that commonly shows resistance. Now, many groups don't show resistance, so it's not always necessary to be this cautious about looking at susceptibility. When we're considering the medical condition of a patient, we need to consider, do they have any allergies? What's their previous history? Do they have kidney disease? Are they pregnant? Is there heart disease involved? Because this can greatly affect the drug that's chosen. So now the question becomes, how do we test the susceptibility of a particular microbe to a particular drug? We'll cover a few different mechanisms and measurements that are used. First of all, there's the Kirby-Bauer disc diffusion assays. This diagram represents a petri dish with a special media in it. We take the microbe in question and spread it all over that dish. And then small discs with pre-measured amounts of antimicrobials are dispersed across this microbial lawn, because we've grown essentially a lawn of microbes across the dish. Then it's incubated. After incubation, we'll notice that there are some zones of inhibition. The zones of inhibition are these areas in which bacteria are no longer growing. That means that the antimicrobial contained in the disc has been effective out to that range. So essentially, the larger the zone of inhibition, the more susceptible the bacteria in this lawn are to what's on that disc. The smaller the zone, the more resistant they are. The measurements from the bacterial lawn in the petri dish are then compared with the standards for each drug that you can see in this table. Here's a set of results for Staphylococcus aureus. From these, we can tell whether they are either resistant or susceptible. In this process, we come up with an antibiogram, that is, a profile that provides data that's useful for professionals in deciding which drug to select. Another test is using e-test strips. It's an alternative to the Kirby-Bauer test. The strips contain a gradient, and that gradient is actually marked on the strips. You'll see these sort of oblique patches where there's less growth in this region and progressively more growth as we move to a lower gradient of the drug. Here we can literally determine the minimum inhibitory concentration by reading it directly from the strip. The third test we'll look at is a tube dilution assay. This is a more quantitative and sensitive test. Here, the antimicrobial drug is diluted serially in a set of tubes. Then each tube is inoculated with a uniform sample of the culture that we're interested in, and then we incubate it. After the incubation, we simply look for growth or turbidity and see the smallest concentration of the drug that inhibits growth. This is the minimum inhibitory concentration. In this case, this tube here. Now this test is done for multiple different antimicrobials in order to establish which one would be the best choice. We're essentially looking for the smallest effective dosage of each. The therapeutic index is another tool that will help us decide which drug is best to use. Ideally, we're looking for low risk of side effects versus the highest probability of killing the pathogen. We want to decrease the potential for superinfections as well as other adverse reactions. So ideally, we have a highly selective toxicity and low human toxicity. The therapeutic index is the ratio of the dose of the drug that's toxic to humans as compared to its minimum effective therapeutic dose. So let's say 50 micrograms of a particular antibiotic is toxic and 5 micrograms is effective. The therapeutic index, or TI, would then equal 10. So 50 divided by 5 equals 10. However, if you have 50 micrograms that's toxic and then 1 microgram is effective, you take 50 divided by 1, the therapeutic index is 50. This is a much preferable number. The higher the therapeutic index, the better off we are. Or the closer the two figures are in number, or the smaller the ratio, as in 50 over 5, is smaller than 50 over 1, the greater the potential for toxic reactions. So a bigger number overall is better. So we have two measures that we've been looking at: minimum inhibitory concentration, or MIC, and therapeutic index, TI. When drugs have similar MICs, the drug with the highest TI has the widest margin of safety, and so that one would be chosen. So if we go back to this figure, here we've got 2 drugs that have a similar MIC, or 3 drugs with a similar MIC. If we were choosing between each of these 3 drugs, then we would take the one with the largest TI. So that brings us to the end of this chapter's worth of material. I know it was a lot of material. Spend a lot of time in Learn Smart. Remember that you can do additional Learn Smart even after you've completed the assignment so that you can stay current and well studied for the exam. Before we go though, let's have a quick concept check. What does a large zone of inhibition indicate on the Kirby-Bauer disc diffusion assay? Is it high toxicity to the patient? That the bacterium is resistant to the antibiotic? There's a low toxicity to the patient, or that the bacterium is susceptible to the antibiotic? Well, if we've put an antibiotic disc onto a bacterial lawn and we get a larger zone, that means that it's had a greater effect, and thus the bacterium is more susceptible to that antibiotic.